We're here tonight to celebrate two things. One of them being the recognition of Manet Community Health Center and National Community Health Center Week. The other is to honor a person who's a critical part of Manet's success. Her name is Dr. Jennifer Sevier.
But thank you so much for coming. I'm so happy to have friends and family and patients here to help me celebrating this honor, and I appreciate it. And I just want to say, when I was looking for jobs, there was, I was looking at a lot of announcements, and I was practicing in the Bay Area of California, which is kind of a beautiful place, and I lived within walking distance of the Bay Area and could see the Golden Gate Bridge. But I saw a picture of this job. Here was a community health center, and this beautiful picture of Hull. And I'm going, oh my gosh, that looks fabulous. And so I was like, this is too good to be true. And it probably was. But I keep telling my patients, this is one of the most beautiful spots on earth. Every morning and exercise, walk up and down the Fantastic Beach, keep in good shape, and stay healthy, and you don't have to see me too often. Thank you very much again.
Before January 2006, I had only been seen at Manet a couple of times. Because of that lucky fact, the physician named as my primary care provider on my insurance card was just a name, as unfamiliar to me as I was to him. In fact, I don't even remember who the doctor was, having had only minor medical issues that were easily taken care of by Manet's wonderful and caring physician assistants and nurses. Then, in January 2006, what I thought was a backache was diagnosed as stage 3 renal cell carcinoma, a very aggressive form of kidney cancer. So now, with a truly serious diagnosis, a personal relationship with a primary care doctor was of paramount importance to me and my wife, Robin. The Manet physician who got me through this difficult and challenging time was Dr. Chris Nagel. My introduction to Dr. Nagel was when he walked into the exam room with a piece of paper that had my diagnosis on it, and he was shaking worse than I was. That was how we met. We immediately bonded. It doesn't matter who you are. When your doctor tells you you have cancer, your first thought is, I'm going to die. In the months that followed, I relied heavily on the staff of Manet Community Health Center for medical information, advice, and the human understanding that was needed during this incredibly stressful and frightening time. Gratefully, Dr. Nagel and the staff at Manet saw me through the initial stages of my diagnosis and surgery.
In total, the Hull practice site cared for 23% of Manet's overall patient visit volume last year. To these patients, we provided $89,044 in free care. That's care to people who could not afford their care. In addition, we absorbed $64,739 in bad debt. That's from patients who could have paid but didn't. Total free care and bad debt came to $153,743. On a break-even budget, that's the difference in raises for staff this year. As an economic engine on the South Shore, our Hull practice generates $1.5 million in contribution, most of which is plowed back into the local economy in the form of payroll to 15.8 full-time equivalents, usage, supplies, maintenance, and other costs. 2/3 of our patients carry some form of health insurance subsidy like Medicare or Medicaid. 1/3 carries commercial insurance. It's interesting, somebody was asking me about this earlier, assuming that 1/3 carrying commercial insurance paid us better. Not necessarily so. These are people who could go anywhere for their care though, but they choose to come to Manet first. We are their provider of choice. And that's what we aim to be with all of our patients every day.
045.
That is so wonderful. I'm Monica McKinney. I was behind the post when you introduced me. I work for Wellspring, so thank you. But I noticed you guys have an event coming up. Shall I pay it forward? I would like to do that. I really would.
Okay.
So thank you.
Actually, this is the chair of the selectmen for the town of Hall. And I go to see them.
Yeah, see, there you go.